Good afternoon, and welcome to Advocacy 101. What is advocacy and why does it matter? Featuring Julienne Verdi. I'm Brandy Underwood, the Manager of Development, Research, and Advocacy for the Facial Pain Association. Before we begin, I want to go over a few housekeeping items. On your screen, you should see an option for both Q&A and chat. We encourage you to connect with other attendees using the chat feature. Please reserve the Q&A for your questions, and we'll get to as many as we can following the presentation. I plan to monitor both, but using the designated option will hopefully allow us to get to more of your questions. Now, it is my pleasure to introduce Julienne Verdi, the Executive Director of the Alliance for Headache Disorders Advocacy. Julienne is a graduate of Brooklyn Law School, where she was an Associate Managing Editor of the Brooklyn Journal of International Law, Chair of Brooklyn Law Students for Reproductive Rights, and recipient of the Platinum Public Service Award and Evelyn Reed Memorial Prize. Julienne received a Bachelor of Arts in Political Science with special honors from CUNY Hunter College, where she graduated magna cum laude and was a member of the Thomas Hunter Honors Program. Julienne is admitted to practice law in New York, New Jersey, and the United States District Court for the District of New Jersey. Prior to starting at AHDA, Julienne ran her own law and consulting practice. She also served as the Director of Government Relations at Planned Parenthood of New York City, a judicial law clerk to the Honorable Francine A. Schott in New Jersey Superior Court, and completed a postgraduate legal fellowship at Safe Horizons Immigration Law Project, where she provided immigration services to victims of crime. During law school, Julienne interned at the Domestic Violence Bureau of the Kings County District Attorney's Office, Staten Island Legal Services, and the Center for Reproductive Rights. Prior to law school, Julienne worked as a political consultant, a researcher for the Office of Speaker of the New York State Assembly, and interned at the office of Congresswoman Carolyn B. Maloney and Planned Parenthood of New York City. Additionally, Julienne has served on the board of several nonprofit organizations, including Community Health Action of Staten Island and Fearless Females. Following the 2016 elections, Julienne founded Move Forward Staten Island and served as the organization's chair for 5 years. As chair of Move Forward Staten Island, Julienne served as a lead organizer for the Staten Island People's Climate March in April of 2017, one of the largest demonstrations Staten Island had ever seen, drawing over 500 people in support of common sense policies to protect Staten Island from the harsh realities of climate change. In her capacity as chair of Move Forward Staten Island, Julienne also directed and produced her first documentary, Staten Island's Huddled Masses, an immigration storytelling project in September of 2019. In addition to her accomplishments, Julienne is the proud wife of Kevin Lowry, founder of Lead Forward, and mother of her 4 young children, Jude, Sloan, Monroe, and Cambria. Julienne, it is an honor to have you with us today. Please take it away.
Thank you so much. It's wonderful to be here. Good afternoon, everyone. I am truly honored to be here today at the Facial Pain Association's virtual conference. Thank you all for joining this session on Advocacy 101. What is advocacy and why does it matter? As Brandy shared, my name is Julienne Verdi, and I have the privilege of serving as the Executive Director of the Alliance for Headache Disorders Advocacy and our sister organization, the Headache Alliance, Inc. My journey into the world of headache advocacy is grounded in lived experience as a person living with migraine, as well as a mother of an 8-year-old child living with migraine as well, which has led me to dedicate my career to making a difference in the lives of those affected by these challenging conditions. So let's talk about the organizations I represent for a minute. First, the Alliance for Headache Disorders Advocacy, which was established to advocate for equitable policies for individuals with headache disorders. Our primary focus is to bridge the gap between patients, caregivers, researchers, healthcare providers, and legislators. The AHDA is a member organization uniting headache organizations across the country under one umbrella and the same legislative goals. We are so proud that the Facial Pain Association recently joined the AHDA and that Brandy Underwood now serves on our board of directors. The second organization, the Headache Alliance, Inc., is our new sister entity with a mission to improve the quality of life of those living with headache disorders through patient and provider education, communications campaigns, advocacy, and early stage research. So what are our objectives today? Today, we're going to do a deep dive into the world of advocacy. We'll explore what advocacy really means in the context of health and specifically facial pain disorders. And we'll discuss the different types of advocacy, including self-advocacy, awareness advocacy, and legislative advocacy. Each type plays a crucial role in our continuous fight to improve the lives of the 40 million Americans living with headache disorders, including facial pain. By the end of this talk, I hope to inspire you to either begin or intensify your own advocacy journeys, equipped with the knowledge and tools you need to make a tangible difference. So what is advocacy? As we begin, let's define advocacy in the context of health. Advocacy involves actions taken to influence public policy, public opinion, or personal decisions to create positive changes in people's lives, particularly for those affected by certain health conditions. In our case, those conditions are facial pain and headache disorders. Advocacy takes many different forms, each important in their own right. Today, we'll focus on three primary types of advocacy. Those are self-advocacy, awareness advocacy, and legislative advocacy. This is not an exhaustive list, and you may think of additional types of advocacy that I'd love to hear about. So feel free to add those into the chat. Let's start with a type of advocacy you're likely very familiar with as patients and providers, and that's self-advocacy. Self-advocacy is about empowering individuals to speak up for themselves, to ensure their needs and rights are respected, and to take control of their health journey. For someone with facial pain, this could mean learning about their condition, communicating effectively with healthcare providers, and advocating for their pain to be taken seriously, and making informed decisions about their treatment options. It might also include things like advocating to your insurance company to cover the treatments you and your doctor have determined are best for you. Self-advocacy doesn't end in a doctor's office. It might also include things like advocating for workplace or school accommodations for yourself, or advocating within your own family to take your pain seriously. Self-advocacy is often the first way advocates get involved with advocacy. And of course, it's the most personal and usually ongoing throughout a person's health journey. I know Facial Pain Association in particular is very focused on helping individuals with navigating self-advocacy. So why is self-advocacy important? It builds confidence and promotes independence. It also leads to better health outcomes because when patients actively engage in their own care, they are more likely to adhere to treatment plans and less likely to feel marginalized in their healthcare experiences. Self-advocacy can also be important in awareness advocacy. When you advocate for your own needs and your own personal journey, it puts a face and name to a health condition, helping to raise awareness for others, which is what we'll talk about next. So moving to awareness advocacy. This type of advocacy involves raising public understanding of facial pain disorders, which are often misunderstood and stigmatized. By educating the public, healthcare providers, and policymakers about the realities of living with these conditions, we can foster a more supportive environment. Awareness campaigns can take many different forms, from social media blitzes to educational workshops for healthcare professionals. They can also be walks and awareness ribbons. It can involve things like public service announcements and blog posts. And the goal of awareness campaigns is really to debunk myths, to spread factual information, and ultimately enhance the quality of care received by patients. Awareness advocacy is a natural evolution out of self-advocacy that patients and providers can start to do by just talking to the people in their lives about what they personally experience. Invisible disorders like facial pain, migraine, and other headache disorders and other chronic pain disorders are particularly benefited by awareness advocacy because they are so stigmatized and misunderstood and not visible to the eye. So by raising public awareness, we can begin to impact change, not just for ourselves like we do for self-advocacy, but also for our community of people living with these conditions as a whole. So again, a natural evolution in a person's advocacy journey can be moving from self-advocacy to awareness advocacy and then to legislative advocacy. Legislative advocacy is about influencing laws, policies, and regulations at all levels of government. It's critical because the decisions made by our legislators directly affect the healthcare services, funding, and rights available to those living with facial pain. Legislative advocacy is the Alliance for Headache Disorders Advocacy's sweet spot, if you will. We work to activate individuals and organizations to advocate to policymakers to act to make life better for the 40 million Americans living with headache disorders. So why does legislative advocacy matter? And what does it mean in the context of facial pain and other headache disorders? In a representative democracy like ours, legislative advocacy is crucial. Elected officials are tasked with representing the interests of their constituents, and constituents are the people who live within the areas they serve. So there are districts drawn on the state, local, and federal levels, and those districts, your representative will represent the people within those districts, and those people who live within or work within those districts are called their constituents. Constituents are the cornerstone of democracy, and their opinions are vital because they affect an elected official's chances of re-election. This relationship gives constituents the power to influence public policy by expressing their needs and concerns to their representatives. For facial pain and other headache disorders, we know so many of the issues that impact the lives of those living with these often disabling conditions are directly influenced by legislative decisions. That could include things like insurance coverage and regulations directly impacting what medications and other treatments you as patients have access to, or the hoops providers have to jump through to get approval for those treatments they recommend, or reimbursement rates on visits impacting the availability of specialists in the first place. Research funding is also influenced by legislative decisions in the annual appropriations process. If less research funding is allocated by Congress, there will very likely be less research happening in the headache disorder field, which impacts the amount of new researchers choosing the field as a career in the first place. Disability laws, workplace accommodations, school accommodations, Social Security regulations are all other areas where our legislators may have the power to make the lives of people living with facial pain better or worse. All right, so now we're going to talk a little bit about targeting the right audience for our advocacy. So when it comes to advocacy, one of the first and most crucial steps is identifying the correct audience for our efforts. This decision shapes our strategy and approach, ensuring that we direct our resources and messages to the most impactful recipients. Here's how we go about it. First, we identify the problem. We identify a problem impacting our community, whether it be a lack of funding for research, inadequate healthcare policies, or barriers to treatment access. Understanding the issue in depth is our starting point. Okay, so now we know the problem. So we can begin to troubleshoot how we can influence change. This involves several key considerations. So some issues are best addressed at the agency level. So we're going to decide, is this an agency issue or a legislator issue? So if it's an agency issue, this is like, when we're talking about specific regulations and administrative policies affecting healthcare. Other issues, on the other hand, require legislative change and are thus directed towards state or federal legislators who can propose, amend, or enact laws. The other thing that we need to think about, is this an executive branch who is the proper audience for us, or the legislators themselves? So when we focus on broader policy changes or enforcement of existing laws, we may need to direct our efforts towards members of the executive branch or government agencies, from the president and federal agencies down to state governors and their administrators. Then we'll look at, is this a federal, state, or local issue? The level of government we engage with depends on the scope of the problem. Federal issues involve national policies or funding, while state or local issues might focus on specific regional healthcare services or local public health regulations, local Medicare policies, those sorts of things. Local Medicaid policies, those sorts of things would be more focused on the state level. We target lawmakers who are in a position to influence the specific issue at hand. This includes those who sit on relevant committees, represent areas heavily impacted by headache disorders, or show interest in healthcare reform. Lawmakers are, again, primarily motivated by their constituents because they are the voters who hold them accountable. Therefore, we focus our efforts on engaging and mobilizing constituents to voice their needs directly, making it clear that there is strong voter support behind our advocacy. So it's great when AHDA has meetings on our own, which we'll talk about in a minute. That is something that we absolutely do. But we think it's even more impactful when it's not just me, representing those living with headache disorders, but when they hear from people in their communities, when lawmakers are hearing from people just like you in your community talking about these issues directly with them. So again, by determining who the right audience is for each specific advocacy effort, we can then craft targeted campaigns that address the heart of the issue. So the strategic approach not only maximizes the impact of our efforts, but also ensures that we are engaging with the most influential figures capable of driving real change in policy and practice. So as I said, as the AHDA, we do a lot of advocacy on our own, just as the organization. And then we do a lot of things that are more grassroots advocacy, where we try to engage medical providers, patients, caregivers, and researchers to also act. So I want to talk a little bit now about organizational legislative advocacy tactics and some of the things that we do on the organizational level. So as organizations committed to advocating for those with headache disorders and facial pain, the AHDA and FPA are actively involved in several key advocacy activities as organizations. So one of the things that the AHDA does is we participate in coalitions. So we participate in broader health policy coalitions, uniting with other organizations to strengthen our influence and extend our reach in policy discussions. Then there's something called sign-on letters. We often add our name to collective sign-on letters or even lead such initiatives to address specific issues, demonstrating widespread support or concern within a community. So sign-on letters are letters that are circulated to different organizations. And the goal here is to get like a nice long list of sign-ons from community organizations and across the country. And the more names that you have on there, the more strength that you show when you send that letter to a government agency or a legislator in support or against a specific issue. So other things that we do on the organizational level, we submit comments and testify at hearings. So we actively submit comments to government agencies or legislators, providing expert insights and data to inform policy decisions that impact those that we serve. Representatives from our organization also sometimes testify at legislative or regulatory hearings, presenting firsthand knowledge and advocating for policies beneficial to our community. And then, as I mentioned earlier, those grass-top advocacy meetings. So we engage in grass-top advocacy by meeting directly with legislative offices to discuss our concerns and proposals with key decision makers to ensure they understand the specific needs of those affected by headache disorders. So we're going to dive a little deeper into each of these. So in terms of coalitions, the AHDA is not a large organization like the American Heart Association or American Cancer Society. We're a lot smaller with a lot less capacity, but that doesn't mean we don't have influence. And one of the ways in which we increase our capacity and influence is by joining in coalitions where appropriate with other disease states to pool our resources together to make a larger impact. The AHDA, for example, is a member of many coalitions that help us to keep an ear to the ground on a variety of issues, as well as lend our voice when appropriate. Two of our legislative priorities this year, we are actively working very closely with coalition partners on. We'll get into this a bit later, but they're the Safe Step Act by being a part of that Safe Step coalition, and our advocacy around funding for veterans living with headache disorders, and that's within our coalition that we are a part of with the American Academy of Neurology. So coalitions also help us to have a seat at the table in larger health policy conditions so that we can ensure that the unique issues impacting facial pain and other headache disorders are thought about and considered as policy initiatives and proposals are being talked about behind the scenes. So the Long COVID Alliance is an example of where this is important. So we joined that coalition because we know that so many people are being diagnosed with new headache disorders as a result of having long COVID or seeing an exacerbation of their symptoms after having COVID. And headache was sort of not something that we were seeing in long COVID conversations, long COVID policy. And so we joined that coalition to make sure that everywhere long COVID is being mentioned, that headache disorders are being mentioned as well. So sign-on letters, like I said, are another way where we pool resources and our strength in numbers to impact change. For example, on the screen, you can see the first page of a sign-on letter that we sent to the White House in support of the White House Women's Health Research Initiative, where we advocated for funding for research into headache disorders, with facial pain specifically mentioned, with the understanding that many headache disorders disproportionately impact women. We are very proud to see all of the progress in this area over the last few months with increased research funding specifically for women's health, and that the requests for proposals also explicitly include headache disorders. As I mentioned, we also often submit comments to regulatory agencies or other open comment opportunities to highlight headache disorders. On the screen, you'll see an intro paragraph we used around the long COVID definition and models of care and the importance of including headache disorders. This one was sent to the National Academies of Sciences, Engineering, and Medicine, and we had sent this off to a few other agencies as well. And like I said, we do participate in year-round grass tops advocacy. So our staff engages in grass top advocacy meetings with elected officials and agency staff to discuss issues impacting the headache disorders community. Grass tops meetings are important because we need to be in regular communication with offices year-round, but we firmly believe, again, that the most important meetings involves not just grass tops meetings meeting our staff, but rather the meetings and communications coming from constituents, patients, and provider advocates like yourselves directly telling your stories to policymakers. So let's dive into what individuals like yourself can do to begin to think about engaging in legislative advocacy. While organizations play a critical role, individual advocacy is equally, if not more, important. So there are many ways that you can personally make a difference, whether it be through direct or grassroots legislative advocacy. So direct advocacy, these are terms you might hear, so I want to define them for you. Direct advocacy involves direct interaction with elected officials or their staff. This can be a highly effective way to communicate the specific needs and issues of those affected by facial pain disorders. By engaging directly, we can provide firsthand insight into how policies impact our lives, pushing for changes that can lead to significant improvement in healthcare and support. So there are a few different ways that you can engage in direct advocacy. It could be calling a legislator's office. A phone call to your legislator's office can be a powerful way to voice your concerns. You briefly state your issue, how it affects you, and what action you wish the legislator to take. Another way that you can engage in direct advocacy involves signing a form letter or petition. These are prepared by advocacy organizations like AHDA to address specific issues. So we have a template, we have the content of that letter already ready for you. You just input your name, your address, and then there's usually an opportunity where you can personalize it. It's always great for you to personalize those form letters so that it's not just a numbers game where the elected official gets all of the same message from everybody, but they can see that you took the time to personalize it. It's going to be read with, it's actually going to be read if you personalize it. So we always suggest that you do that. But if you don't have time, you really could just write your name and your address and hit send, and the system behind the scenes automatically routes it to the right legislator for you. So that's a simple way that people start to get involved with legislative advocacy. But if you want to take it a step further, you can think about personalizing letters or emails and writing something directly rather than using a form letter. And like I said, personalized letters or emails can deeply impact legislators. This is where you have a chance to share your story and explain why certain policies or changes are necessary from your unique perspective. And the last way I'll mention, and we'll get into this a little bit further, but you can participate in advocacy events. So events like Headache on the Hill, which is an event that the AHDA puts on, which we'll get into shortly, provides a structured opportunity to meet with legislators and advocate directly. These events often include training sessions to help you effectively communicate your message. So that's direct advocacy. But then there's something called grassroots advocacy. And grassroots advocacy complements direct advocacy by mobilizing the broader community. It's about encouraging the individuals in your own life and community to collectively raise their voices in support of yours on a specific issue. This type of advocacy amplifies the message, demonstrating widespread support for or opposition to a specific policy. When officials see that a large number of their constituents care about an issue, they are more likely to take action. Examples of grassroots advocacy for an individual can include things like writing a letter to the editor, sharing a petition or take action email with others, attending a rally, talking about legislative or policy issues on social media with a call to action for others to join you. So by using these methods, constituents can effectively shape the agenda of their elected officials. And the more personal and consistent the communications, the more likely it is that officials will listen and actually act. And remember that every voice counts, and together our voices can actually lead to meaningful change. So personal stories are what change hearts and minds. Engaging in advocacy does not require you to be a policy expert. You don't have to have gone to law school or studied political science or really truly understand fully how the government works. It's a labyrinth, even if you are someone who does this work. You don't have to have a fancy degree or experience. So often potential advocates think that, I don't know enough to talk to a lawmaker. And I'm here to tell you that is absolutely not true. You know enough. What legislative advocacy really requires is just a commitment and willingness to share your personal story to impact change. Your personal experiences and the genuine reality of living with facial pain are powerful tools. These stories put a face and name to the statistics, making the issues relatable and urgent for lawmakers. And while statistics are essential for understanding the scope of an issue, they alone are not enough to change hearts and minds. And this is why advocacy organizations like ours exist. And if you ever join Headache on the Hill, you'll hear me say this at every single training I ever do. If statistics alone were enough to change hearts and minds, organizations like the Alliance for Headache Disorders Advocacy just would not need to exist. We already have statistics on our side. It's not enough. The way that we change hearts and minds is by telling our personal stories and putting a face, name, and a real-life example of the impact of headache disorders, including facial pain, on lawmakers' constituents. This is one of the main things we do at AHDA, help to empower individuals to effectively tell their personal stories in short, succinct, powerful ways. So one of the main ways that we do this is through Headache on the Hill. Headache on the Hill is held annually by the Alliance for Headache Disorders Advocacy in Washington, D.C. Volunteer advocates come together to personally present Congress with requests or asks. These asks seek to spotlight legislation affecting the headache community. Headache on the Hill is the only federal advocacy day dedicated exclusively to advocating for equitable policies for the 40 million Americans living with headache disorders. So last month, we held our first fully in-person Headache on the Hill since before the pandemic. We had a total of nearly 275 advocates, and for the first time ever, those advocates represented all 50 states, which we were incredibly proud of. It was also our most diverse cohort of advocates to date, and that's the picture that you're seeing on the screen right now. And this is not all of the advocates, but most of the advocates who came to Headache on the Hill this year. Our advocates went, and I'll just say the advocates participated in over just about 300 meetings throughout the day with 300 different members of Congress than their offices, which was really exciting. Our advocates went through a vigorous training program on everything from how a bill becomes a law to how to tell their personal headache stories and how to engage with the press. It was a truly magical few days in DC. So I'll talk a little bit now, shifting gears to what are the 3 things that we advocated at this year's Headache on the Hill, just to show you an example of why we do this, how we do this, and the different types of issues that impact, legislative issues that impact people living with headache disorders, including facial pain. So we advocated for several key pieces of legislation as part of Headache on the Hill, including the Safe Step Act. This bill is designed to streamline the insurance process known as step therapy, ensuring patients can access the best treatments for them without unnecessary delays. Step therapy, sometimes called a fail-first requirement, is a protocol in which a health insurer will deny coverage for a prescribed prescription or treatment until an alternative insurer-preferred treatment is first attempted and the patient fails on that first. Some medications require multiple steps or multiple different medications tried before the provider-prescribed prescription is approved. The goal of step therapy is supposed to cut treatment costs, but for many patients, fail-first policies delay needed treatment. Furthermore, insurers, force many individuals to squander their money on ineffective medication before they are able to go on to a productive treatment plan. We know patients with headache disorders are some of the most impacted by step therapy protocols. And we know that with many headache disorders, delay in care can mean a disorder advancing from episodic or less frequently to chronic, which is much harder to treat. So the Safe Step Act outlines 5 exceptions to fail-first protocols and requires that a group health plan grant an exception if an application clearly demonstrates any of the 5 following situations. 1, patient already tried and failed on the required drug. 2, delayed treatment will cause irreversible consequences. 3, that the required drug will cause harm to the patient. 4, required drug will prevent a patient from working or fulfilling activities of daily living. Or 5, patient is stable on their current medication. So on this 5th one, this is thinking about non-medical switching. So a patient is already stable on a prescribed drug. selected by his or her provider, and that drug has been covered by their previous or current insurance plan, they should be exempt from having to go through stepped-up therapy protocols before that medication is covered by their insurance company. So this was one of the main issues that we participated in and advocated for during Headache on the Hill this year. So facial pain and other headache disorders do not discriminate, and neither should our research, which is why we also advocated at Headache on the Hill in support of the NIH Clinical Trial Diversity Act to ensure that clinical trials funded by NIH reflect the diversity of the population affected by headache disorders, including those with facial pain. The NIH Clinical Trial Diversity Act seeks to address critical gaps in clinical research by promoting inclusivity and diversity in clinical trials, recognizing that diseases affect people differently based on a variety of factors, including race, ethnicity, age, sex, and sexual orientation. The Act underscores the necessity of including a broad spectrum of participants to ensure that scientific advances benefit all communities equally. Historically, clinical trials have predominantly recruited white male participants, leading to significant knowledge gaps in understanding how diseases, treatments, and preventative measures perform across different populations. This limitation is particularly concerning given the diverse ways individuals experience diseases and respond to treatments, thereby impacting the quality of healthcare decision-making and treatment effectiveness. So to achieve this goal, the NIH Clinical Trial Diversity Act would require NIH to work with clinical trial sponsors to develop clear and measurable recruitment and retention goals based on disease or condition prevalence, as well as a rationale for specified goals and a recruitment plan. It would also require and ensure the availability of less burdensome follow-ups during clinical trials. So fewer follow-ups, having the ability of phone participation and weekend hours to increase participation of underrepresented populations, because being involved in a clinical trial is often onerous and burdensome. And so by making it easier to be a part of a clinical trial, the hope is that we can increase participation. And finally, would launch a public awareness campaign across federal agencies related to research participation opportunities. And lastly, our final legislative ask, we pushed for increased funding for the Headache Centers of Excellence, which provides specialized care and support for veterans living with headache disorders. On the screen, you'll see a map of the current 28 headache centers of excellence throughout the country. The white dots represent the headache center hub sites, and the purple represent the affiliated sites. Hub sites have a full complement of multimodal interdisciplinary headache services, including neurologists, health psychologists to do cognitive behavioral therapy and biofeedback, clinical pharmacists to ensure knowledge related to medications veterans are prescribed, whole health and complementary and integrative health specialists, headache nurses for education and training on headache devices, and rehabilitative medicine experts to offer other non-pharmacological ways to restore function for those veterans living with migraine and other headache disorders. Hub sites also provide telehealth care throughout their geographic catchment regions. Associated sites, on the other hand, are currently resourced to offer access to a headache medicine trained neurologist and some components of interdisciplinary headache care, but not the full amount of services that I just talked about. So for this ask, we were asking for $28 million in fiscal year 25. That would be up $4 million from what was currently passed for fiscal year 24. They were funded at $24 million. And the idea is that this increase in funding would be used to permit all of the headache centers of excellence to be resourced to a hub level, thereby ensuring that all centers will be able to provide the highest level headache care while increasing their ability to reach out into surrounding areas to improve headache care access. So we were really proud this year that we have done a few things to increase representation from the facial pain community at Headache on the Hill. A special mention goes to Brandy Underwood from the Facial Pain Association, who attended Headache on the Hill, representing the facial pain community. This year, we were also proud to have at least 15 advocates with facial pain joining us, highlighting the specific challenges and needs of this community. We also added an application on TN for the first time this year on the Headache on the Hill application. So even those who couldn't join us in person at Headache on the Hill this year played a crucial role. We sent over 2,000 letters to Congress by supporters around the country, amplifying our voice and ensuring that our message was heard loud and clear across legislative offices. We're already seeing the impact of our work with at least 21 legislators taking action on our asks in just about 1 month's time since Headache on the Hill, which is something that we're incredibly proud of. So looking ahead, we have a virtual Headache on the Hill scheduled for September 24th. We hope to see even more participation, especially from the facial pain community. This is a wonderful opportunity for those who may not be able to travel to Washington, D.C. to still make a significant impact and have their voices heard. Applications for the event will open in the beginning of June, so keep a lookout for that. So I encourage everyone here today, especially those of you who are directly affected or know someone affected by facial pain, to consider thinking about the ways that you can move through your own personal advocacy journeys. Your advocacy could be the key to bringing about real change for your community as a whole, because your voice and your personal story is unique and important. I want to thank you for being here today for this talk, and to the Facial Pain Association for giving me the opportunity to be here today. Thank you so much. And I think we can take questions.
Yes, thank you so much, Julienne, for an incredible presentation. And it's fantastic to hear about all the ways that the Facial Pain Association and the AHDA is partnering to help raise awareness about facial pain and about headache conditions and what we can do to partner. The first question from the audience I'd like to take is Anna Williams, who was a participant at Headache on the Hill with us this year. She asked, can you talk about why each story matters? What if I feel like I don't really have a story? Where might you tell a person to start in finding their story?
Everybody has a story, right? Everybody who is experiencing some sort of health challenge, whether it be, again, facial pain or arthritis, whatever your health challenge is, we all have a story about how long it took us to get diagnosed, right? How does it impact your daily life? What was your worst day like, right? One of the things that I've talked about when I tell my personal migraine story is, the worst migraine attack that I could remember, right? And what that looked like, what it felt like, how it impacts my family, not just myself. Does it impact how does it impact my work? I mean, so many people have had to leave the workforce because of their health condition. So I think that all of us have a story one way or the other, whether it be when your symptoms started, again, how it impacts your health, how it impacts your home life, your work life, your schooling. Have you had to make different decisions in your life, a different trajectory for your life than you maybe wouldn't have otherwise? All of those matter. All of those stories add give that personal touch and understanding about what this condition actually is, and how, and gives the legislator an idea of, okay, this is not just a headache, right? Or it's not just, oh, okay, facial pain. What does that mean, right? It's explaining this. It's just showing, not just telling, right? You're going into the full experience about what it means and why this specific piece of legislation could make a difference in someone's life, like myself or you.
Yes, thank you, Julianne. And thinking about when we are meeting with those legislators or their offices and asking, do you know someone with facial pain? Or, it predominantly affects people, in their fifth or sixth decade of life. Women, do they have a mother, a grandmother, an aunt, a sister, a friend who they know who may be affected by this? So, uh, great advice. Great advice. Here's another question about from Shelley. She asks, how do we learn about bills that are up for a vote that we would want to call our legislators about?
Absolutely. So AHDA is one place that you could find out. And so if you follow us on our website, you get on our email list and get on, follow us on social media, et cetera. And one of the things that we do is we put out calls to action. What we will tell you when something is coming up that we think particularly impacts the community. And I'm sure that FPA will help us do the same within the community itself too, as amplifying these opportunities to take action on a specific vote. The other places are, certainly just following your elected official, right? So you can follow your elected official on their, getting on their email list, et cetera. But that will often tell you after they vote rather than when they vote. And so I think the easiest way is often to get involved with advocacy organizations, because it's hard to keep an ear to the ground on absolutely everything that might be coming up for a vote. They may vote on 15 different things in one day, and it's hard to kind of break through the noise. And so I think that's where advocacy organizations come into play and can help someone sort of get into this work in the first place.
Thank you, Julianne. You mentioned we actually had a Headache on the Hill debrief. This was, I can't remember if it was last week or earlier this week. They're running together. But during it, you mentioned how the asks, or what we ask our legislators when we're there, how those are determined. Would you mind sharing, how those are formulated, the timeline for that?
Absolutely. Yeah. So I'm already thinking about next year's Headache on the Hill. Obviously, we're thinking about the fall Headache on the Hill, but my mind is already also to March of next year, thinking about what are we going to be advocating for during next year's Headache on the Hill. So the process starts immediately. It starts immediately after Headache on the Hill. And it means us keeping our ear to the ground, hearing about what's going on in the legislatures, and what might be rising, getting some legs and moving along in Congress. So that might be one way. But the other way that we determine and ask is by hearing from patients and providers, hearing from our partner organizations like FPA saying, hey, this is an issue that really is impacting our community. So we might look at a problem and not know what the solution is yet, right? And so we'll look at that problem and say, okay, this is the problem. Who might be the right audience for it? Is it something, is there already a piece of legislation that's already addressing this? Maybe that's something that we can get behind. Or maybe it's not something that there's a piece of legislation for yet. So can we think of the legislative fix ourselves and maybe start working on that? And then in terms of the timeline, again, we'll also be involved with coalitions, and we hear things that way as well. In terms of the timeline, we usually have a sort of large amount of things that we're advocating on from the organizational standpoint. And then we make the decisions from what rises to the top for Headache on the Hill, really up to the, right up to the line of when we need to let our advocates know, because we want to make sure that things are timely. Can we strike when the iron is hot and help push something over the finish line? And for us, that's the Safe Step Act is a perfect example of that. That's something where there's so much momentum right now. And so we are hoping by lending our voice and our 200 and almost 275 advocates from all 50 states talking about this issue, plus all of you at home who are writing letters to your elected officials, that maybe we can be the thing that moves this forward.
Absolutely. And the Safe Step Act, I was really happy to see that on the list of asks this year, because we had already shared that information with our community from Nord's site. They were sharing information about the Safe Step Act. We had a member of our Young Patients Committee who was a pharmacy tech who wrote a piece about, from the pharmacy tech side, and as a person with facial pain, what that's like to navigate fell first therapy. And so that was something that was, on our radar, and to see that on the list of asks this year with Headache on the Hill was wonderful. I think that was really helpful, and I hope to see more progress on that for our community.
I hope so too. And I really think that I really feel positive about it. Is this going to be the year that we get it done? It feels like there's a real potential. And if it's not, I feel like we're going to go into the next Congress with such a strong start that we've got to get this done, right? There's so much momentum. There's so much support around it. So many different organizations, again, from us to arthritis, to psoriasis, to every disease state you can think of is advocating to push this bill over the finish line.
Yes, including the epilepsy community, and those and many anti-seizure medications are kind of like that first line of drug therapy for people with facial pain. And so they're also involved in that space. And like you were mentioning in the beginning, the coalitions and building these groups where we're all working to better the situation for all of us.
Absolutely.
So in our session, first, let me say, I've seen several questions about disability and Social Security disability benefits and coming up in our chat. I did want to mention that in our session on data to discovery, navigating facial pain research, I shared information about how one of the AHDA's previous successes was the Social Security Administration issuing its first ever guidance around headache disorders in the Blue Book, which is the set of policies that determines who's eligible for Social Security disability insurance. And the guidance included trigeminal autonomic cephalias, but did not go so far as to mention TN. My first question is, how do we even get involved in that? How was that accomplished in the first place? And what could we do to help influence that for trigeminal neuralgia and other cranial neuralgias?
Sure. So I'm going to try to answer this the best I can because some of it predates me a little bit with AHDA. But this is, so thinking about Social Security and thinking about, the policies and that are in place with how someone becomes eligible for Social Security, there's a lot of issues, right? There's a lot of issues that impact our community. And so, it started, my understanding was a lot of conversations with the agency itself, with members of Congress, with other disability organizations, and really thinking about this issue and bringing it to the attention and saying, hey, the headache disorders, there's no mention anywhere, right? And we need to change this because there's a lot of confusion about if they're eligible and how they're eligible, because most of the other sort of considerations when you're looking for eligibility around Social Security, it's you need to show some sort of test that you have that can point to having the condition, and that symptoms aren't enough. But with a headache disorder, you don't often see anything on an MRI, right? You don't. So you can't point in that same way to a blood test for or an MRI for arthritis. I'm someone who has arthritis, right? So I think about that, right? That is easy. You can find that, you can see that, I can show that. I can't show my migraine except for explaining my symptoms. Otherwise, I can't show it with an actual test. And so this was an issue that was coming up over and over and over again. So there was a lot of advocacy behind the scenes, a lot of letters written, pushing for this guidance coming out. And, it was a great step forward, but we know it's certainly not enough and the work isn't done. We actually worked on some draft legislation on this issue that, might be something that we try to advance in the future. It is, something that we're constantly thinking about and keeping an eye on what's sort of going on in this field. What are other disability groups advocating for? Could we get something tacked on to a piece of legislation to add something in? We're constantly looking at those opportunities, but it starts with also just reaching out to the agency, because sometimes it's just a lack of, thinking about this specific disease state. So, we've done this, for example, with Department of Education. We reached out to Department of Education because the IDEA, which is the piece of legislation that determines how children with headache disorders receive accommodations in school and special education services in school, doesn't explicitly mention headache disorders. And so there's this other category that headache disorders should fall into, but there were some school districts who are misinterpreting it, right? And they're saying, oh, well, you're not explicitly mentioned, so you're not covered. So this started a whole advocacy sort of campaign for us last year. And, with us reaching out to Department of Education and trying to get them to issue a guidance memorandum. And then when that wasn't happening on their own, reaching out to Congress and getting Congress to write a letter asking the department to do this. So this is something, those are sort of the steps that we can take and that we have taken on different things. And I think it's something that we could think about, is this something that we should get involved with? Could we be asking Social Security to do this for TN and, other facial pain disorders? So it's something that we could absolutely talk about and see if there is something that we could do.
Thank you so much. And there was a question here, just kind of as a follow-up. I'm excited to talk about the IEP piece and then this as well. Someone was asking, I guess how, as partner organizations, do we have priorities from the facial pain community kind of added to that? And I guess if you could talk a little bit about how your partner organizations serve on the board and have those conversations.
Yeah, absolutely. So the way the AHDA is set up as a legal organization and a legal entity is that we are a membership organization. We're really proud to have many, and if not most, of the headache disorder organizations, from whether it be cluster headache to facial pain, to all these different organizations, as members of the AHDA. And with membership comes also board membership. And so that means that the leaders of all of these other organizations have a direct say in how our organization makes priorities and thinks about different issues. We also have committees, and we have committees where we have both board members on as well as our volunteer advocates. And we workshop different things. So one of the things is a policy committee, and the policy committee meets and to help think through different issues involving that we should potentially get involved in. We might, we make decisions. Should we sign on to this letter? Should we not? Should we take action on this? Should we not? And then we also workshop issues. So, the spinal CSF leak Foundation, for example, brought up an issue with a specific needle and how it, raises the risk of CSF leak. And so there was the issue. Then we all talked about, okay, who is the appropriate audience to address this? Because there's this other needle that's much safer. It's just not being used. We determined what the agency is that would be better suited to address this issue, and then thought about different ways to address it. And that's sort of the process we're in now. So we could be absolutely doing that for more issues involving facial pain, and thinking through what are the, we need to hear from people, because I certainly don't know everything, and I rely a lot on hearing from people on the ground on the issues that are impacting your lives, whether it be a patient or provider, giving us that's, these are the issues that are coming up in this specific community, and how can we figure out a way to address it and help it.
Excellent. I think we have time for one more question here, and it is from Rachel Scherer. She would like to know, please let us know how to obtain your templates. I think she's referring to the templates to reach out to your legislators.
Yeah, so if you go onto our website, which is headachealliance.org, one of the first things you'll see is there's a take action email. There's a take action that you can take on in support of our legislative agenda, and so that is a nice, quick, easy way. But again, just staying in touch with us, with AHDA, with FPA, you'll hear about different opportunities as they come up throughout the year on different ways to take action.
Thank you, Julienne. And look for later in the year, we'll be adding an advocacy section on our website where this information will be available. And as they come up, as Julienne said, we have sign-on letters or advocacy asks, we will reach out to you. So thank you so much, Julienne, for today's incredible presentation on Advocacy 101. What is advocacy and why does it matter? We will have this session transcribed after the conference, which should be available when the recorded sessions are up on the conference platform. Dr. Levy and Dr. Mansdorf's presentation on describing facial pain to your practitioners began 30 minutes ago, but if you'd like to join that session, which is already in progress, you're welcome to do so. Just navigate back to the agenda on the homepage and select the presentation entitled The Language of Orofacial Pain. As a reminder, all sessions are recorded so you can view the entire presentation at a later time. We have about 30 minutes before Melissa Bombick, the FPA's CEO, delivers closing remarks. That will start at 4 p.m. Eastern, 1 p.m. Pacific. Don't forget to visit our sponsors and partners in their booths, including the AHDA, and you can navigate to the homepage and click sponsors or partners in the main menu in the left margin. Thank you so much for being with us today.
Thank you. Thank you.